that is turning 65. It's initial, it's there. I think you and I sometimes just call it open enrollment.
Sure. And I think that's the thing is like all these terms are so interchangeable and people, get so confused.
Yes. So the initial enrollment period or open enrollment period, if you will, is 3 months before, the month of, and 3 months after.
Your 65th birthday.
65th birthday. So, you do have that 6-month window to make any decision you want to make without any medical questions. Then you have the people that, remember I said 65 is the new 55. So now you have people that are going to work till 75. And so now when they enroll at 75, they need to talk about Medicare,
right?
Because now they're coming off of group insurance. So that is called a special enrollment period, which is SEP. And that is where you have so many days to turn in that creditable coverage letter from your employer, turn your Part B on, get your drug plan. You're not penalized because you decided to work past 65.
Right.
Probably missed a few vacations in there.
Maybe.
Yeah.
Maybe.
But, you still will be able to do things if you're on group insurance.
And hopefully, like we've said before, hopefully those individuals have not turned on their Part B. Hopefully they just have their Part A, which is the freebie. And then we can assist them, or your broker can assist you with turning on your Part B, turning on your supplement or advantage plan, and getting your drug coverage plan. Yep, that's all during your SEP special enrollment period.
Yes, and then you have general enrollment, which is for everybody on Medicare.
Yep.
So that comes around October 15th through December 7th. Did we already talk about that?
Well, we just said that that's the time for, considering your Part D, your drug plan, that's the time that you can get your prescription, change your coverage. They make changes. So, but I think that your GEP, or your general enrollment period, that is that October 15th through December 7th time frame.
And we will have all the new drug plans and everything usually come to us about a month before, but we're not able to enroll you in anything until after
October 15th.
October 15th. I usually tell my clients, funny story, I tell my clients to remember me on Halloween.
That's I say that, or either remember me at Halloween or when you're eating your pumpkin pie.
Shut your mouth.
Yeah. Thanksgiving. If you're thankful for me as your broker, then remember me at Thanksgiving.
Oh, that's better.
Yeah.
I always say I want to be the Medicare witch.
Oh.
Yeah.
That's not very nice.
Think of me at Halloween.
Yeah.
And I am the Medicare witch, and I will do your drug plan at that time. So yours is better. I might use yours
if
now.
You're thankful for me as being your broker,
okay,
and you're eating your pumpkin pie.
Okay, I'm using that.
Think of me. Call me.
Okay.
Let's make sure everything is good. The last thing I wanted to talk about, I get a lot of questions about what about dental and vision? If I am breaking away from my group health insurance, what are my options for dental and vision coverage? And I have to say, Darla, I have not found a dental coverage that I just love. Especially breaking away from group health insurance on, their dental plan that seems to be quite comprehensive. I've not found a dental coverage plan for Medicare that I love. Have you?
No, and I've looked at a few. I mean, I guess my deal is if you really put the numbers on paper and you look at the fact that you're paying $45 a month, let's say, for dental insurance,
right,
and the maximum it's going to pay for something major is $1,000.
Right.
I've almost paid that in premiums. Now, if you're getting 2 cleanings and x-rays and you're doing all of that religiously every year,
which you should.
Yes.
You should, right?
Okay.
Yep.
Way to throw that in. You could benefit from it. I have found, you and I are not dentists. I always tell people, go ask your dentist.
Yeah.
Just say, what should I do? Should I do a dental insurance, or will you work out a cash payment arrangement with
Sure.
me? So a lot of dentists are very open to discussing options with you. And I just think that should be kept a little more personal between you and your dentist. If he says, hands down, you need to be on a dental plan, you get bigger discounts, whatever, then, there are several standalone dental plans that you can use. And a lot of companies, even when you retire, I know that state employees are eligible to keep their dental insurance through the state, and they'll just hold it out of your retirement check. Totally individual decision on what your needs are going to be on dental plans. Vision is a little different.
Right.
So we've had that discussion about vision. It's not that expensive. A lot of times you can do a vision plan for pretty cheap, but what would you say your biggest coaching that you tell your people on vision? I mean, how do you feel about that?
I feel like because now Medicare is going to cover all of the medical concerns that you might have with your eyes, that I personally, and I may be the only insurance person that will ever tell you don't purchase, insurance, but I've not found a vision plan that I like well enough to think that the juice is worth the squeeze. So now that, Medicare is going to cover your medical concerns as they apply to your eyes, you're really only getting your vision insurance to cover your materials. And now with there being the Warby Parkers and all of the online options of the world, I really feel like that you can just cash pay for those and you're not going to rack up a terrible amount of out-of-pocket expenses. And if you're the kind of person that wanted a very specific name brand frame every single year, your vision insurance isn't going to pay for that anyway. So I don't know. I think it's, again, to your point, I think it's, very personalized, what's going on with your personal vision. But most of the time I just have my clients utilize their Medicare plans.
Yeah, I agree. And I think it would be a good time to mention when we talk about vision problems, those of us that are close to 65, cataracts is the big neon sign, right? Like it's going to happen to almost all of us.
Sure.
So cataracts can be very expensive. I would say $1,500 to $2,000, an eye. So it needs to be known that Medicare will cover that. Medicare does cover cataracts. The other big one is glaucoma, macular degeneration.
Right.
Those are probably the three that I hear more about. And Medicare actually covers those procedures.
Perfect. All right. Well, I think we've covered everything that we can explain about Medicare. Disclaimer. Subjects that we discuss on the podcast are meant to be used as topics of conversation. All figures given are sheer examples. All information is subject to change and probably has changed since the airing of this podcast. Rates and figures change depending upon the demographic in which you live. Anything discussed in this podcast is our opinion. We do not represent Medicare, any governmental agencies, or any of the carrier partners on the show. Each person should do their own research on the various websites to ensure accuracy.